your dog has had a hygroma surgery, then it is really important for you to follow all of your surgical recommendations from your veterinarian after surgery. In fact, the care you provide for your dog after hygroma surgery is as important to the success of that surgery as the surgery itself. So there's multiple things that are super important. First of all, when you do surgery on the skin of the elbow, there's just not a lot of skin there, and it's a high motion space, right? So this skin is moving and moving and moving, and it's really hard for that skin to heal. The sutures that they put in there are going to keep that skin together long enough for it to heal. But if the dog is active or allowed to lick or chew at that surgical site, then there is a higher risk of failure of that surgery, which means that that surgery will just break right open and you'll be right back in the vet hospital paying for another surgery. So when your veterinarian says that you need to keep your dog quiet after surgery, then you need to do that. That means inside the house, in a kennel when you're not with him, outside on a leash only to urinate and defecate. We're not letting that dog off the leash and not letting that dog run around the yard at all. That is also making sure that that dog is not jumping, right? We don't want the dog running or jumping because that skin needs to heal, and it takes 10 to 14 days for that skin to heal. So another important thing is to make sure that that dog is not licking or chewing at that surgical site. Most likely you are sent home with a bandage over that. So you're going to make sure that that dog does not remove the bandage, whether if it's with a bite knot collar or an e-collar that you put on the dog, whether it's putting a stocking that the dog wears, a onesie that has a sleeve that goes all the way down, whether it is talking to your veterinarian about pain control, because the number one reason that dogs will lick or chew at a surgical site is because it hurts, and then later it itches because the skin is healing. So you need to talk to your veterinarian, make sure you have adequate pain control. If your dog is happy and bouncing off the walls and loves to be active and doesn't want to be cooped up, then you need to talk to your veterinarian about a sedative as well. Your veterinarian can prescribe something to you that will keep that dog quiet. And you want to make sure until those sutures come out and you see that that skin is healed up, that that dog does not have access to that surgical site at all, or you're going to be right back in with another surgery. And I can tell you the second surgery is going to be even more difficult to heal. So you want to do everything right from the first get-go. The second thing is there's going to be a bandage. So you want to make sure that that bandage stays in place, that that bandage does not get wet, that there's no odor coming from that bandage, because an odor is indicative of an infection. You want to make sure that the leg below the bandage and the toes look normal. So they're going to have you checking the toes for any kind of swelling, because that's signs that the bandage is slipping or it's too tight, right? So you're going to have bandage care. And that bandage is going to be really padded, because we want, when that dog lays down, for it to lay down on padding. So you may be asked to do some bandage care at home as well. If you don't understand what your veterinary care team is telling you, make sure to ask questions. Don't be ashamed to ask questions. Make sure you understand what you're getting into, because this is your investment in your dog's health, right? So ask questions, and if you don't understand, don't hesitate to ask more questions. And if you're not comfortable with what things look like, send in a picture. Take a picture of what it looks like, send it to your vet, or take your dog back to the vet. Or if you're not comfortable with the bandage care, take it in and have them do the bandage care for you. They would love to do the bandage care for you. The last thing is you're going to want to make sure that you finish all medications as prescribed, including antibiotics and pain meds, because the signs of pain in dogs are very subtle, and you might be thinking, my dog's doing fine, doesn't need any more pain meds. Well, probably still needs the pain meds, because you stop the pain meds, then the dog's like, well, what is this thing? And then it starts chewing, right? So finish all the pain meds, finish all the antibiotics, very, very important if they're prescribed. Lastly, if your veterinarian recommends any kind of adjunct therapy, such as photobiomodulation, right? That's just a fancy word for cold laser therapy. It's an awesome therapy that speeds healing, not very expensive, not invasive, feels very good to your dog. then do it, because this is an investment. This is you making sure that your dog is going to heal the best possible after hygroma surgery. And then lastly, you're going to want to make sure to get back in for all of your post-op rechecks. Most likely they'll have you back in for a suture removal and then a checkup after that. So those are my best tips for how to help your dog recover the best from a hygroma surgery.